Hi everyone. This session we're going to discuss about literature search in public health. Hi, I'm Associate Professor Dr. Victor Hoe from the Center of Occupational and Environmental Health UM. This session is divided into three parts. The first is literature in public health. Second is planning and conducting a search. Third is managing the search result. Today we're going to discuss about literature in public health. What is literature in public health? Literature in public health are information that is necessary for implementing public health intervention or understanding public health issues. Having up-to-date, accurate and unbiased information is important for a public health practitioner to be able to make informed decision. The keyword is informed decision. You must make an informed decision based on up-to-date, accurate and unbiased information. Domains that influence evidence decision making. First, we look at the environment and organization context. Within it, there's best available research evidence. And then we look at resources, including practitioner expertise. And we also need to look at the population. So it's not just best evidence. It is looking at who are the experts in the field and which population are we talking about. And only that, taking the three things into account, that is what is called evidence decision making. Where can I find literature in public health? Literature in public health or literature related to public health comes in many forms or of various quality. The selection or decision of which source of information to use depends on what you want to do with them. Example, do you want to use literature to review before starting a research, or you want to identify a research topic, or you want to understand in-depth understanding of an issue, or deciding which investigative equipment to purchase, or making a decision of public health issues in real time, or just for basic knowledge about public health issues. Where to start? How do we search? Basically we can use the World Wide Web and start using word or phrases to search what we want. And that search engine usually refers to a web search engine, enterprise search engine, or personal search engine, like on your personal computer. How search engine works? Web search engine works by storing information about a large number of web pages which they retrieve from the World Wide Web. These pages are retrieved by a web crawler, sometimes also known as spider or robot. The content of each page are then analyzed to determine how it should be indexed. Some content-specific database index the page manually. These are some of the search engine. Old search engine. Searching the World Wide Web using the common search engine like Google is useful and easy. However, the quality of information depends on the topic of interest. Example, if you want to search for Ebola, tuberculosis, and platelet-rich plasma, looking at Ebola, we can find that most of the information on the first page of Google is related to Ebola. So we have information from WHO, information from CDC, which are the two main sources of reliable information. For tuberculosis, which is an important disease, we also get the same information from CDC and then also from WHO in the top 5 searches. But for public health related topics like Ebola and tuberculosis, the top 3 sites are WHO, CDC, and NHS UK. These are the important and reliable public health sites and should be the source of information for basic knowledge about public health issue and could also be used for making decisions on public health issue in real time. But let's look at non-public health related topics like platelet-rich plasma. For more medical or less public health topics, searching using Google alone is less reliable. Wikipedia, WebMD, and Mayo Clinic are useful sites for medical-related information. Although the general Wikipedia is open to editing by anyone who log in, topics related to medicine cannot be changed easily. The information is also more reliable and consistent. When we look at Ebola virus, when we search on Wikipedia, you notice that there's a log at the top right-hand corner of your screen. Basically, the log means that the information of the Ebola virus cannot be changed easily, and means that we can trust those information. Even for diarrhea, for a less important page or less important topic like platelet-rich plasma, where you see that there's no log at the top right corner of the Wikipedia, the information are usually not trustable because anybody can actually change the information. And these are biased and it's based on people with interests who would like to write information which benefit them. So to sum it up, Wikipedia actually could be used for basic knowledge about a public health issue. A caution should be used when making a decision on public health issue in real time. If we think that the information can be trusted, then we can use the information. So those with a log is what is usually more reliable. So the level of evidence in public health starts from system information, summaries, synopsis of synopsis of single studies and studies. So what is a system? Systems are very detailed decision support service that match information from specific client, individual groups with the best available evidence that applies. Basically, it is a computerized decision support. And there's no system or computerized decision support in public health. Summaries. Summaries are integrated the best available evidence from the lower level, trying on synthesis, example systematic review, as much as possible, and to provide full range of evidence concerning management option for a given health problem. Summaries of research studies, systematic review, clinical guides, and other evidence. Synopsis of synthesis. Synopsis of synthesis are succinct description of a systematic review or meta-analysis that aims to provide the right amount of evidence for information decision making. Basically, it is summarizing the information available in a systematic review. It's evidence-based. It is found in evidence-based journal abstracts. And synthesis. Synthesis combine using explicit and rigorous method the result of multiple single studies to provide a single set of findings. And this includes systematic review with or without meta-analysis. Synopsis of single study. These are basically summaries of a single studies and very brief description of studies that aim to provide the right amount of evidence for information decision making. It is what we call synopsis of original articles. The lowest is the study itself. Evidence from single study or original journal article. For literature review, before starting a research, for identification of research topic, for understanding an issue, or for deciding which investigation equipment to purchase, and for other different approach of searching literature is required. This will be covered in the next section. Thank you for your attention.